Very good. Representative Dunbar.
Thank you, Mr. Chairman. Thank you, Secretary. I'm going to follow up a little bit briefly on what Representative Daly and Representative Camp were talking about community health choices. Seeing that I am from Westmoreland County, and we're pretty much the guinea pig, I guess you would say, amongst the state, and we've moved along through the process, all the way through the RFP process, and even know who the provider actually is. I believe, is that finalized? Is that correct?
I don't think any contracts have been awarded, but the announcements made, which then led to some bid protests.
Yeah, and a quick question: because the provider, the person, the company that won the RFP, is actually a healthcare system themselves. You know, there's some concerns that other providers have said about steering and things like that. And I was wondering if there's any type of individual entity or any type of organization that you've designated to oversee the process, so either consumers and/or providers have the ability to lodge complaints to. Is there some type of system set up already for that?
But with all due respect to your question, the contract procurement process itself has been solely under the purview of the Pennsylvania Department of Human Services. I really would not be equipped to answer that question.
Okay. And just in general terms, the whole idea behind the community health choices is not something that we had voted on or had a whole lot of input on. Is the goal dollar savings or higher quality services? And if it's dollar savings, do you have some type of estimate once it's totally rolled out what the dollar savings will be? Because it is an appropriations hearing, so.
Correct. You know, to the actual dollar savings, that would really be within the purview of the Department of Human Services' current budget. However, to the efficiencies to be achieved, you know, it is our expectation that with regard to such as the independent enrollment broker process, such as waiting list times, that with more folks aging in place and with the baby boomers coming into our system and more individuals needing to access long-term services and supports, the current structure of the safety net of just an aging waiver program or under 60 waiver programs is going to be stretched beyond our capacity to provide the services and supports that folks need. So just as other states have journeyed through a managed care organization model of providing managed long-term services and supports, we believe that we can better manage the dollars that we're investing into the program by working with the managed care organizations on a capitated payment system in order to ensure that older Pennsylvanians can age in place.
Okay, thank you.